Were 40 and older and graduated, and one person was 52 years old in the medical school. So don't even worry about it. Think of it as a long-term thing, or maybe if there's a bad, and I'm using this term loosely, a bad case scenario. You're 39 and you get your medical degree. Well, most people retire around 70, 75, right around there, right? Well, that's 35 years of practicing medicine. That's a lot. I think we're going to really tired of people.
So if you work, say, in a hospital setting, can that count?
Yes.
Okay.
Yep.
Now, going back to your GPA, 3.5, do medical schools take the fact into consideration that some universities are harsher on their grades and some others are easier to get A or B?
They take it into account, but not for the GPA. That comes in the interview. Here's the thing: if you take a genetics class in Davis and Berkeley and here, I expect everybody to have the same requisite amount of knowledge in genetics, whether they got a 3.5 or higher. They should understand the topics. See, this is where I have a problem with grades. Grades don't reflect the knowledge. And how do you find out if you really understood? Well, you'll find it out in the interview. So let's say they're going around and that actually brings up a good point. So they're looking at your application, and here's the questions that they're asking now. Here's one question you may get, but you probably don't ask too much anymore. Why do you want to be a doctor? Why do you want to be a doctor?
Because I like home.
Yeah, you know, that's probably the number one answer. If we were playing Family Feud, you'd be perfect. Yeah. How many times can you actually hear that and not puke? They've been hearing that since medical schools have actually been around, right? So that's a standard answer. I want to help people. You know, it would be refreshing to say, I've always wanted a Lamborghini. You know, that would be refreshing. But it probably wouldn't get you through the interview. So now they're starting to ask you different types of questions. So they're going to look over here and they go, oh, you took immunology and you took virology. This is great. And you did very well. Okay, I am a virus. I'm going to tell you, I'm an RNA virus. Why don't you take me a tour through the infection? Start from me coming into your nasal olfactory system and all the way out to where I enter. And then they're going to ask you to give them the tour. You should be able to give them the tour. If you can't, then they're going to give you some more questions. They're going to be very polite, and then when you leave, they're going to throw your file over here. Okay, so those are the new types of questions that they're going to ask. They're going to ask you questions that there are no right or wrong answers, but there's some answers that you better have be able to answer for. For example, if you want to go into medical school, can you talk to me for 5 minutes on Obamacare? That's going to affect medical treatment immensely starting this year. If you can't tell me what Obamacare is and how it's going to affect you as a medical student, a medical doctor, then again, what are they going to do? Toss your application to the side. There's a lot of ethical questions. Will you perform abortions? You know, that's a big deal. And you could say, okay, I will perform abortions if the case be be. So once you start performing abortions, you are now an abortionist doctor. You will do it. Now let's say we're 35, 40 years from now, and we find out that, hey, we've discovered that there's a gay gene. Now the mom comes over and says, I need to abort my fetus. Why? Well, I found out I have a gay gene. Now what do you do? So all these ethical questions start coming in. There are 4 states right now that allow for doctor-assisted suicide. Oregon is one of them. If the patient comes in and says, I can't do it anymore, I didn't sign up for this kind of pain. I need you to do something about it so I don't suffer anymore. Well, what is the Hippocratic Oath? The Hippocratic Oath says you will not do any harm to your patient, right? But is keeping them in that kind of pain harming them? Or is it not? You know, it's a tough situation. These are all ethical questions you have to figure. Now, if you're going to go into medical school, there's a movie out, and it's called How to Die in Oregon. You seen it? This is a wonderful movie. It's a movie based on euthanasia. So about 4 or 5 years ago, Oregon said doctors can assist patients who are terminal, not depressed, terminal, having a disease, and they're not going to make it very longer, but the pain is intense. They can actually tell the doctor that I want you to give me enough morphine to put me out. And that's what you want to do. You want to see this and say, am I prepared to make these kind of major decisions? Every potential doctor should see this movie. It's a really great movie. It's a vignette of 7 or 8 different people and how the medical system has really circumvented their own choice. And the doctors who have to make that choice. Because remember, what is the doctor doing? The doctor is giving a lethal dose of, let's say, morphine, Demerol, or something to that effect. They're, in essence, killing the person. So they have to live with that. And that's a tough thing to do. Yeah. Oregon. Yeah. The state. So let me go ahead and pass some of these out. You got 3. I'm just going to grab it. Biology. Now, here's the difference. Health science is wonderful if you want to be an administrator, you want to be a nurse, you want to do something in a health-related field. If you want to be a doctor, a medical doctor, a PA, I would suggest you go either as a biology degree or a chemistry degree. That's going to give you the requisite amount of knowledge that you really need to understand. Not only the medical terminology and understanding the system, but really understanding concepts. Conceptual. Health science, you don't really get that. I mean, if you're going to be a medical lawyer or something like that, health science is great. A health administrator, great. Public official, great. But if you want to do something more related to working with humans, then you want to do something like biology or chemistry. Now, everything you do has to make yourself. Oh no, I appreciate it though. You have to make everything you do has to make yourself competitive. So when you come into Cal State and go into the biology department, there's a bunch of options. Don't take the general BS. The general BS is good for if you want to do certain things like teaching or something to that effect. But you want to take an option. An option means that your upper division courses is going to give you a opportunity to take more courses within that particular discipline. So the 3 that would be very important for people who are going into medicine is cell molecular biology option, the microbiology option, and the physiology option. So look at what you have to do here. You have to take 1 year of Gen Chem, 1 year of OChem, 2 quarters of general biochem. You should take trigonometry or calculus. Now I'm just going to stop for those particular quarters right there. Plus you have a year of physics and biochem. Okay, here you have chemistry 4411 and 4412. That's biochemistry. In reality, you should take a full year of biochemistry because one of the first classes you're going to take in medical school is medical biochemistry. Even though you're not going to get credit for it, you should take a full year. If you go down to math, 1300 or 1304 on cell molecular option, you can take trig or calculus. You have to make yourself that much more competitive. You should not only take the calculus, you should take the full year of calculus, integration and partial derivatives. Because other people are going to be taking those and it makes them that much stronger because they can handle these kind of courses and pass them. If you only handle the one course and pass, and I have another application that's taken the full year of biochem and the full year of calculus, well, this is a much better go-getter, right? Has more ambition and did well in there. I'm more inclined to bring them in. And you got to be careful because you can screw it up in the medical interview very easily. Okay? They're always looking for reasons not to bring you in because whatever's left over, those are the cream of the crop. If you want to be a veterinarian, that is the cream of the crop. There are only 26 schools in the nation for veterinarians. So that makes it much more competitive. to get into veterinarian school. So you've got to make sure that when you talk, you can talk the talk. You can talk to a doctor and communicate with them in a scientific way. And that means not only verbally, but in the written form as well. I'm going to go back to the verbal form, because how many people here like to public speak? 1, 2, okay, 3. 4 people. So, most people hate to public speak. But let me tell you something, as a physician, you will be doing a lot of public speaking. You need to get over that fear. Now, we have a thing here called the Toastmasters. Anybody heard of Toastmasters before? I love the Toastmasters. Toastmasters gets over your fear of speaking. Because what do? They give you a little food, always a good one. And then they'll come over here and they'll give you a topic. And then they're going to say, okay, you got 3 minutes to organize your thoughts. And then get up there and do it. Okay? And now you're going to go up there and do a talk. And every single person in that room is going to be rooting for you. Why? Because they have to do the same exact thing. Can you organize your thoughts? Can you speak in an intelligent way? And this is where your GS comes in. Because your GS is important because that's what makes you an intellectual. That's what makes you a smart person, that you can understand concepts and understand important topics like, let's say, presidential elections. If I was to show a picture of Joe Biden in some of my classes and ask them who this is, they wouldn't have a clue. And that is bad. That's very bad. So you want to make sure that you can be an intellectual and speak in very intelligent terms. But medicine is going to be not so important with the GS classes, but going to be important with your major courses. And so take a look at these courses and take a look at them on our website and see what they entail. And you will see that they are going to be pretty tough courses. Now, my email is on there. So it's Kenneth Curr, C-U-R-R. If you have any questions, you want to just come by and talk to me, and I can ask you some more questions, by all means. Most people don't get in there, and they're not willing to put that kind of effort in. And that's a big deal. Now, for PHAP, we have 3 years of assessment. So the program that just started 3 years ago. So we have an average of, for the PHAP students, of a GPA of 3.8. That sounds pretty good, right? 3.8, that's right up there with 4.0. But when you look at their average MCAT scores, their MCAT scores are 23 or 24. 23 or 24, they won't even look at your application. They'll just put it to the side. And I would say a competitive score right now, and this is only this year, because the MCAT is going to be changing next year, is a 30 or a 31. If you don't have a 30 or 31, don't bother, they're not going to look at it. Many of the bigger schools like Columbia, Harvard, Yale, what they do is they have an algorithm. And that algorithm will tell you whether you look at the application or not look at the application. The average committee for a graduate school, a medical school, is 20 faculty. If you have 1,200, 1,500 applications, they're not going to go through all those 12 or 15. Those 20 people are only on the committee. So they got to triage them out and get it down to about 400 or 500, something that they can work with. Okay, so you don't want to be in this PHAP program because you were so immature in your undergraduate work. Most of the people in my cell molecular, they still have that high school mentality that they did very well in science, but they could actually cram everything the night or 2 nights before the test and come in and regurgitate it. Well, that's not what's going to happen here. Okay, my class isn't based on regurgitation at all. So memorization is very little, about 20%. 80% is concepts. And that's what's going to be very important for you as a doctor. Okay, and concepts are very hard to understand. If you memorize something, you're going to forget it not too long afterwards unless you use it every single day. If I'm a patient and I'm coming in clutching my heart, chances are it could be a heart attack, right? I might have pain down my arms or legs. But what if it's not a heart attack? It could be something else. If you start giving, let's say, blood thinners or adrenaline or something, you're going to end up killing the patient. So that means you have to really think about what's going on. You can't memorize, okay, pain in the arm, clutching the chest, heart attack. You know, that's just not going to be the case. So conceptually, concept questions are very important to understand. The University of Florida, about 5 years ago, did a study in which they followed 7,000 or 8,000 students for 4 years. They asked them certain questions about concepts. And then when they left, they asked them the same type of questions. Okay? 80% of them could not understand what a concept was. And even though they were graduating 4 or 5 years later. That's pretty sad. That's very sad. So, excuse me, so now you want to get yourself set up right now and work your way that every year you're in this institution or whatever institution you go to is going to work your way toward that goal. And it's tough. I know it's tough. You know, Friday nights, your friends are like, oh, you worked hard all friggin' week. You deserve some time too. So let's go dancing. And you're like, I did work hard all week. I do deserve to go dancing. And you go dancing. And then the next thing you know, you do it for Friday night and Saturday night, and you're losing all your study time. Or your boyfriends or girlfriends. That's even worse peer pressure, right? It's like, you spend all your time in the book, and you're ignoring me. Well, unless they're planning on paying for your graduate and your medical degree, get rid of them. I am not a big fan of relationships until you get your degree, and I'm going to tell you why. You can't put 100% into both of them. It's impossible. You either want a career or you want to have a nice, steady relationship. And I've seen people, even medical students, get in relationships together and they couldn't handle it because one person is always more ambitious than the other person. I had a friend who she was in medical school, she got pregnant, and the guy offered to, help her financially, but that's it. He wasn't going to help her in any other way. She couldn't handle it. She had to quit medical school to raise the child. She became a nurse. Now, she loved being a nurse, but that's not what she wanted to be. Okay? You're put into these kinds of situations where sometimes the curveball happens. And you've got to be careful for that kind of stuff, because that's the stuff that will lead you out of medical school. Okay, any questions so far about anything I'm talking about? Yeah.
I'm kind of in that middle zone where I'm not a GHAP person yet, but I am taking some courses from taking, the 60 class. How is that going to be viewed later on down the line?
It depends. What's your,
I don't care.
If you go to medical school sites, you're going to say that the minimum GPA is 3.0 and a few other things that they ask you to do. But in reality, if you have a 3.0, you're probably not going to get in. Okay, yeah, that's the minimum that you need, requirements that you need. But in reality, it's not that they're looking at your application. They're looking at your application in respect to everybody else's. So your mindset has to be that there's always someone better than you that is out there. So what you got to do is try to keep yourself. Now, if you have a C or above, don't bother with taking the class. What I would do is maybe stay a little bit longer and take some more upper division courses and pull your GPA up. Okay, now here's some, now GPA is very important. Okay, I'm not saying it's not important, but you shouldn't worry about it. Because the GPA is actually worthless overall. It doesn't tell me anything. I could have a person have a 4.0 come into my lab and not know a damn thing. Okay, so it's if you understand the material, the grade comes with it. And students are too worried about getting the grade and not getting the information. Okay, the information, a lot of people will take courses in which they don't take the prerequisites. Always look at your catalog. What is the prerequisite? I know what a prerequisite. What's a prerequisite? You know? Yeah, exactly. It's not a class that you have to take so you can take the upper division. It's a class that you have to understand the material, utilize that material in your upper division courses. That's what a prerequisite is. Just because you took it and passed it doesn't mean that you're ready to take the class. Okay, so for example, cell molecular. That is a prerequisite for genetics. If you don't do well in cell molecular, you will not pass genetics. I can guarantee that. It is just because, remember, when I was taking genetics back in, it was the textbook is about that thick. Now it's about that thick, but we still only have 10 weeks in order to get through it, because this is a quarter system here. So that's rough, because the first 3 weeks is your first set of midterms. Your second set 3 weeks is your second set of midterms. And your third 3 weeks, well, that's final. And guess what happens after that? The next quarter. And that happens very quickly. It ages you. You know, I'm only 27. These quarters really age you. So you've got to be prepared. If you fall behind, there is no catching up. It's very, very difficult to catch up. And so you have to keep up with everything. And I'm not saying it's easy, it's very hard. If it was very easy, though, everybody would want to do it, right? Now, for science, we have a high entry rate, but we have a lower retention rate. The reason being is that we have students that watch, you know, crime scene investigations or NCIS or Grey's Anatomy, and they're like, oh, I can do that. And then they come in and they find out I just can't do this. And that's rough. That is very rough. They do not need to be in this program. Another people who do not need to be in this program, and I say this in all earnest, is that sometimes family puts a lot of pressure on you to be a doctor or to be a professional. And it's not something you want to do. Well, in this case, and I know family pressures are rough, well, this is the time that you have to be an adult and talk to your family and say, this is not what I want to do. Because what you end up happening, and I see this every quarter when I do grad checks, I have students that come in, they do a grad check, they have C's and D's and maybe a couple B's in their transcript. They're graduating with a 2.1 or 2. They don't have the ability to make it into any interview for biotech or some science-related field. They don't have the GPA or the requisite knowledge to get to a certificate problem, and they'll never get it into a terminal degree. A terminal degree is your medical degree, your PhD, pharmacy, whatever it may be. And that's because they just don't want to do it. And then what did you do? You just spent $20,000, a lot of tears, a lot of pain, and it's a worthless degree. I know a person up in chemistry who got her master's, and she just made it through. She really didn't have the requisite knowledge that she needed to get through the interviews. Now she's doing very well as a receptionist at one of the hotels down in Oakland. Okay, so she spent a lot of money to get that master's, and that's what she's doing. You know, the system will lead you out. So you really have to have this passion. And I mean passion. You take to be my age, and you throw the covers off yourself in the morning, you put your feet on the ground, you want to go, oh, I get to go to work. Not, oh, crap, work. That's a whole different ballgame. I have a friend who makes $700,000 a year. He hates his job. He hates going to it every single day. He cannot stand it. His only hope is to retire early. But he has a wife, he has a couple of kids, he has a mortgage, he has a life fence and a couple of dogs. There is no way he's giving up that lifestyle or all these responsibilities and finding something new. It's not going to happen. But he just hates going to work every day. And that's hard. You know, you go to a class that you just absolutely hate, right? Think about doing that for the rest of your life. Yeah, it's kind of harsh, right? And that's what you don't want to do. You want to have a passion for what you're doing. You don't want to like it. You know, when you get married, you don't want to like the person. You know, I'll keep you around for a little while. You want to be passionate about it. You want to have this passion where you can't wait to see them. It's the same thing that you want with your career. Because trust me, you're older longer than you are younger. So what are you doing? You're giving up some of your youth for a very comfortable, lucrative career later on. And that's difficult. It really is. Now there's some criteria that you have to do that's going to help you in removing yourself from society. And you're going to need this because this is what you have to do to make yourself competitive. So number one, GPA. you really should have a GPA greater than 3.5. If you don't have a greater GPA greater, and there's always going to be people say, oh yeah, but I had a friend that got in there with a 3.0, and he barely did anything at all, blah, 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 blah. That's the exception, not the norm. He probably knew somebody that helped him out. And that happens a lot, Nepotism is all around. But, bless you. But in reality, that's only a very tiny percentage, maybe 0.01%. You still have everybody else that has to come in the normal way. So you should look at a GPA of 3.5. If you have a GPA of 3.8, you're definitely going to be extraordinarily competitive here. Volunteer hours. For volunteer hours, your minimum should be 2,000 hours of volunteer hours. And that's minimum, because a lot of people are going to have a lot more than that. Now, as high school, that's not going to count in as your volunteer hours. Your volunteer hours come in your college. You need at least 2,000 hours. Most volunteer places, like hospitals, will give you 3 or 4 hours a week. That means that's a lot of volunteer hours that you're going to have to put in. So that means you might have to do a couple of different volunteering. Now, why is volunteering so darn important? Well, it tells them a lot of things. Number one, they're looking for people who are responsible. Because what is it when you're a doctor, an MD, a pharmacist, or whatever? You're a leader, right? You're not. A master's is mastering a topic. A PhD, an MD, a pharmacy. This is mastering a discipline, and that's much, much harder. You're going to be a professional, and if you're going to be a professional, that means you have to know the information like a professional. So they're looking that you can handle a course load, a tough course load. You can handle extracurricular activities like volunteer work, being part of clubs, and being successful at all of them, because that's what they're looking for. A lot of pressure, high success rate. So 2,000 hours takes a little bit of time. So I don't ever say do volunteer work during your freshman year. Your freshman year is too important. You have to acclimate to the system. 10 weeks, like I said, is very, very tough. Conceptual questions, very, very tough. So you have to work your way into the point where you really understand the system. In your second year, now I'm not going to use junior, freshman, and all that stuff because it doesn't apply here. Some people take 4 years, 5 years, 6 years, 7 years to graduate, okay? So I'll use freshman as the very first year, senior as you're leaving, and everything else I'm just going to say you're in the system. So your second year, you start going to take your upper division courses, no longer too much with your lower division courses. That means that now you're going to start to get a lot more information, a lot more responsibility. Now you want to start actually volunteering some work. And this could be at a hospital, it could be at a clinic, it could be at a convalescent hospital, it could be at the Mammalian Center over in San Francisco. It doesn't matter. Volunteer some work. And then this includes also shadowing a doctor. Call up the doctor and say, look, I am totally interested in trying to get into medical school. More so, I'm interested in being, I don't know, a pediatrician. And say, can I follow you and shadow? Most doctors will let you do that. You have to understand that almost all doctors are narcissists. And you want that, right? If they come up and tell you that you have cancer, you want someone to say, okay, I don't know if this is going to work or not, but we're going to try this, 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 and this, and see how well you do. Or you want someone to come up saying, don't buy any green bananas, because you may not see them ripen. So there's a big difference, right? Which one do you want to see? Yeah, I want to see the first one. And so it's very important that, and so you have to be narcissistic to a certain point. Especially as a doctor, and you have to walk a fine line between narcissism and way overconfident. Okay. Any questions so far?
So medical schools don't really care if you graduate college in 4
No, they could care less. And matter of fact, sometimes it's really rough to go in 4 years. Why? Because you do have to pay your own way. You know, it took me 6 years to get out of college, but I had to pay every single quarter. And some quarters I couldn't afford it, so I had to work to pay for the next quarter. And the thing is, you know, don't